time we spoke, you had recommended me doing the ablation,
Yes.
the RFA,
Yes. How did
and
it go?
yeah, the the two diagnostics that I had went excellent. I mean, the first
Mm.
one I had, I think he gave me some, a steroid also with the diagnostic, and for the first week, I had no back pain at all. The following week, I went back for a follow up visit just to see how it was, and it went well. So we scheduled a second diagnostic. We did that. That went well. From the second diagnostic to the actual RFA, I would say it was probably maybe 2 weeks and a half. Zero back pain. So I was so optimistic that it was going to work. So I did the RFA on June 12th. And now it's about maybe 5 weeks out. Back pain still there. Back pain still there. Mostly when I bend backwards, I guess I can feel it even now. My back tightens up a little bit. It's I wouldn't say I got any relief from the RFA at all. But I'm going to see my pain management doctor next week. I guess he's going to come up with something else that may work. But I know I have a lot going on too back there as well. But I guess my question for you, I've been going over my report and so on and so forth, and I know I have three different things as we discussed before. I have spinal stenosis at L3 L4, I believe, and then the herniation um, at L4 L5 and L5S1. I watched the videos on how to figure out where the pain is coming from. Is it coming from the arthritis, or if it's coming from the stenosis, or is it coming from the herniation? And it's kind of hard to tell, when you got so much stuff going on,
Mm.
and if I'm not mistaken, L3 L4, is that the level where only the spinal stenosis is?
Uh, First of all, uh,
Okay, exactly.
like, oh,
Exactly.
I
Thank
feel
you.
like we were like we were in the red zone.
Yeah,
You know what I mean?
yeah,
If you're a football
yeah.
fan, we were in the red zone. We're right on the edge of you had the medial branch blocks, you're pain free, not just pain free for a while, even
For a
after the
while.
numbing wore off.
Yes,
And then go through the RFA and come out. It's like we got intercepted in the end zone.
yes, yes,
And
yes,
man, how frustrating. So, first of
yes,
all, thank you for being here and still smiling.
yes,
It's
yes.
and what choice do we have, right? We got to
Exactly.
get rid of this. To answer your question first about the stenosis, let's go over. Is this a new MRI or is this the one from before?
This is the one from January of this year.
Okay, so it's the same one.
Same one.
Yeah, okay. So we'll go over the MRI again and look at the stenosis. But spoiler alert, you do have stenosis at L4-5 as well as L3-4.
Okay.
However, the most important thing I think you've said is two things. First, it's very hard to figure out what type of pain this is based on the pain. And that's actually a pretty common situation
Okay.
that and oftentimes that's a hint that there's some combination of stuff going on here. But then the second thing that's so important is you got relief for a couple of weeks from the medial branch block. The problem is there was steroid, from what I hear you saying, there was steroid in the medial branch block injection, which makes it very hard to interpret because the medial branch block, the numbing medicine lasts for 4 to 5 hours maybe, but the steroid lasts for 100 hours. So, and you did get that long-term relief. So it's almost like, did you have a trigger point injection? In essence, because you got a steroid
Right.
injection into the muscles that hurt,
Right.
and that's unfortunate, but it makes it hard to process. All right, let's hit the timeout. Let's reset and look at the MRI and then go from there. Is that okay?
Yes.
Couple of clarifying questions. You know, I'm addicted to my clarifying
Sure.
questions.
Sure. I'm ready.
Okay. Now on the pain, there is some pain. Most of the pain is in the back, correct?
Yes. Yes. Most of the pain is in the back.
Left more than right, or right more than left, or they're the same?
I would say more left than right.
Left more than right, but there is some on the right.
There's some on the right. The sciatica is mainly on the right, and when I irritated by even walking on my grass in the backyard, the uneven terrain, I irritate the sciatica all the time, pretty much.
And by
It-
sciatica, you mean the pain shooting down your right
yes,
leg.
exactly.
And that pain never shoots down the left leg.
No, I mean I may have tingling going down. Into my foot. The tingling and the has stopped. That after the RFA, that did go away. I mean, for
Okay.
some, yeah, that went away. So
Okay. Is the sciatica, the pain down the right leg, made worse by walking?
no, I can actually walk with and stand. 2 years ago, when I first had the issue, when it first started, walking for longer than 5 minutes, I had to sit down. Standing longer than 5 minutes, I had to either sit down or lean up against the wall. So now I'm able to walk longer. I'm able to stand longer unless I do something to aggravate it.
Is there any symptoms that you have that are made worse by walking and relieved by bending?
No, no.
Okay. Okay.
I can sit down all day. I may get up and be a little stiff back there, but
Yeah.
no, it's never painful.
Okay. Okay. Well, that's very helpful. That's very helpful. All right, let's take a look at your MRI, okay?
Yes.
The drum roll, please. So this is the MRI, and these are what they call those axial sections.
Yes.
They're perpendicular to you. And in this section, this is your spinal canal.
Yes.
And these are the foramina, the holes that the nerves go out to the side.
Yes.
Like here's one here, and here's one here. And this is, let me just see. So this is your sacrum. This is your sacrum. So here's the first disc is your L5S1.
Mhm.
And then the second disc here is your L45. And you do have moderate stenosis here.
Okay.
Let me see if I can blow this up. So in this view, this triangle should be an almond.
Okay. Okay.
And the part of the almond that's missing is this.
Mm-hmm.
And the reason it's a triangle is this is your ligamentum flavum, the yellow ligament. It's thickened and it's pushing in. And this is your facet joint. And the facet joint is enlarged and it's pushing in. And that's on both sides.
Okay.
The thing is, though,
and that's L4, L5. Is that
this
correct?
is your L4, L5. Yeah,
Okay.
correct.
Okay.
This is your L4, L5. And then you also have it at L3, 4, but
Okay.
it's not as bad.
Bad. Okay.
All right. Let's talk turkey. So
Let's do it.
so let's do it.
Mhm.
So there's three things that we see on the MRI. I want to review each of them and talk about the symptoms because the MRI is not the patient you are. So oftentimes we see things on MRI and they're not relevant. But in your case, first of all, you have spinal stenosis. There are cases in which spinal stenosis causes isolated back pain, like you have.
Mhm.
But the vast majority of the time, spinal stenosis causes pain down your legs with walking that's relieved by bending, which you do not have.
Right. I do not have.
You do not have right now. Having said that, your future is grim. Someday that stenosis only gets worse. So someday you're going to have it addressed. But because you're not having symptoms, my advice to you would be that today is not that day. Let the spinal stenosis, you're healthy, you're a relatively young guy, you got time to
Okay.
deal with the stenosis that's on the MRI.
Okay.
The second thing I see on the MRI is a lot of degenerative disc disease. And degenerative disc disease causes knife in the back, axial back pain that's worse when seated and gets progressively worse over time. And you don't have that either. You've had that in the past, but you don't have that now. So I don't think that's your primary issue either.
Mm-hmm.
The third thing that we see is some facet disease and facet arthritis. And facet arthritis and enlarged facets, the test to find out how much of your pain is coming from the facet is a medial branch block. You had a medial branch block. It relieved nearly all of your pain, suggesting that nearly all of your pain is coming from the facet. But there was steroid in the medial branch block, which makes it a potential false positive.
Mm-hmm.
False positive means the test was positive, it relieved the pain, but it might not actually be the result we think it is because the steroid screwed it up. So
Right.
that's a possibility. The second possibility, and no shade being delivered, the pain management doctor may have missed with the RFA.
Right.
And the reason I say no shade is, honestly, Mr. May, it's about you. Those little pain fibers that come out, I've seen them. I've seen thousands of them in my life because I used to do these. I used to do RFA endoscopically, so I could actually look at the fiber, and it's a little tiny thing. It looks like a little white hair that comes out from under the transverse process and then goes over to the joint. And you can see them, they're real. You can
Mm-hmm.
see them in real life with enough magnification, like we had on the endoscope. But my God, they're all over the place.
Mm.
Sometimes they come right up by the joint through the back and they're not, and sometimes they come around and they loop. And a lot of the time when they put that needle in to do the RFA, they're doing it based on X-ray. They can't see that pain fiber. They're
Okay.
doing it based on where it should be,
Okay.
where it ought to be, but not where it necessarily is.
Okay. Okay.
And so sometimes they do the RFA and they missed. And so you're in this situation where basically there's two possibilities. One is they missed, and the other is the test was a false positive, and you're really an atypical presentation of the stenosis.
Okay. 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 Okay.
Well,
Is there herniation that's being that's caused that's at L4 L5? Is that bilateral or is more to the right?
it is a little bit more to the right, but it is also bilateral. But
Okay.
even more importantly, you really don't have symptoms from that. So I think the way to think of your herniation is that it's part of your stenosis.
Okay. Okay.
You know, in that spinal canal, like we see on the MRI, think of it like a room,
Mm-hmm.
and the floor of that room is the disc. So
Okay.
when the disc herniates, your floor is coming up.
Okay.
When the ligament thickens, your roof's coming down. And when the joint enlarges, the walls come in, and pretty soon you got nothing.
Right.
I'm not making a heart like the kids do. I'm making pain like
Yeah.
we do, right?
Yeah.
It's
Yeah.
just painful. God.
Yeah. Yeah.
So, all right, long story short, what do we do? Who cares what do we do to get rid of it? There's basically two treatments that are likely to be beneficial to you. And the question then becomes, in what order? The first one is repeat RFA.
Mm-hmm.
I don't think it makes sense to repeat the medial branch block because you got relief from that, but you could repeat the RFA.
Mm-hmm.
Every avenue that you go down raises new questions. And
Mm-hmm.
one question I would have is, do you want to go back to the same pain management doctor? And
Right.
the reason I say that is no shade, but everybody does it a certain way, and their way didn't work.
Mm-hmm.
Would it make sense to try somebody else? My chairman was a very mean guy, my neurosurgery chairman. He used to say, even a blind pig finds an acorn once in a while. Like
Mhm.
maybe you go to somebody else, they do it a
Right.
different way
Yes.
and get a better result, or you go back to the same person. That's fair game as well.
Hmm.
Or you seek out someone who does it through an endoscope so that they can actually see that fiber and cut it. That's
Okay.
hard to do. That's hard to do. These other two are pretty easy.
Okay.
Remember, with RFA, the numbers are 60, 80, 10. 60% of patients get relief of 80% of the pain for an average of 10 months.
Okay.
60, 80, 10.
Hmm.
Well, you're in the 40. You didn't get relief. So you're in the 40. Of the people who get relief, man, they get good relief. They get
Right.
80% relief. But
Right.
you're in the 40, so it's worth thinking about that from that point of view.
Hmm. Hmm.
Okay, that's one pathway. There's another one. And the other one is to say, I think the medial branch block was a false positive. I think what we really got here is an atypical presentation of spinal stenosis. And an atypical presentation of spinal stenosis, the best way to deal with that is just to do the laminectomy at L4-5, and then as you get older at L3-4. And nobody wants to have surgery, but you're having it at some point anyway. You'll never be younger or better looking from a surgical point of view
Right.
than you are today.
Hmm.
So, so I mean, that's not unreasonable. It's kind of like, let's just get it over with.
Hmm. Hmm. Hmm.
Upside to that is you're going to have it anyway. Might as well get it over. Downside is sometimes that makes facet pain worse. And if you do have facet pain, you could actually undergo surgery and be worse for the wear.
Mm. Okay.
And
Yeah.
then where are we?
Yeah. Yikes. Yeah. Okay.
Yeah,
Hmm.
yeah. So kind of like where we are right now, where we
Hmm.
got, we got so frustrating. We got relief from medial branch block, but not from RFA.
Okay. Yes. Okay. Okay.
All right,
And
my man. What are you thinking?
the stenosis and laminectomy, the laminectomy, you said that'd be best, do L4, L5 first, and then do L3, L4 later on down the road. Is that what you recommend?
I think so, but I'm not sure. And if you decided on the laminectomy road, I would recommend that you get an updated MRI
Sure.
and that you go to a different MRI center because this one is a horrible magnet.
Okay.
We could get much. It's nothing to do with you, but their magnet stinks, and we could get much better images. And then before any surgeon's going to do surgery, they're going to want to compare the two views to be abs. I'm not. I mean, I was counting the disk spaces. That's not good enough. You
Okay.
you need to be able to co-register the images and look in better anatomical detail. But based on what I see today, I think the surgeon's going to say to you, L3, L4-5 first and L3-4 later if you need it.
Hmm.
You might find a surgeon who says do both. That's the wrong surgeon. You might
Hmm.
find a surgeon that says you need a fusion. That's the wrong surgeon. So,
Okay.
there's a range of things that can go on.
Right. Right. Okay. Okay. All right. I think that was all I think you pretty much hit every nail on the head as far as what questions I had. Okay.
Well, I got a question for you. What are you going to do?
I don't, so, well, one more, I do have a question for you.
Okay.
So since I had the diagnostic, and like you said, it was maybe a false positive because he used steroids. Um, in the past, I did get relief from getting your typical steroid injections. I did get relief from that. Probably, maybe last year I had one before I had the ACDF. Also, I had neck surgery a year ago as well.
Right, right.
And so right before I had that procedure done, I had a steroid injection, L4, L5 bilaterally, and L5S1 as well. It did bring me relief for maybe, I don't know, I guess for maybe 6, 7 months. Back started to flare up again in the beginning of this year. And so would you say, or I guess the question I'm asking you, the diagnostic with the block, was that similar to doing a steroid injection, or that was?
Yeah, I mean that's the doctor apparently put steroid in there.
Right.
The steroid injections that you had were a little deeper and
Okay.
more around the nerve root. They were transforaminal epidural,
Yeah.
but it basically amounts to pretty much the same thing.
Same thing.
I
Okay.
mean, remember, it's not unreasonable. Kicking the can is remember how fun it was to play kick the can as a
Sure.
kid?
Sure.
Kick the can is
Sure.
still fun. Like you can,
Yeah.
if you feel good and you can get relief for 6 months at a time, repeat the steroid block.
Yeah.
And
Yeah.
you can get that done by pain management and the transforaminal space, or your primary care doctor can give you a Kenalog shot, find the spot on your back that hurts the worst, and put the needle in and inject it with no x-ray, no fuss, no muss. They can't do it very often, but
Right.
you know,
Right.
they can do that.
Okay.
So it's definitely kick the can is I should have said is a third option,
Mm-hmm.
and it's legit. I
Mm-hmm.
mean, you got time for this to work out, and the situation is very likely to become clearer over time.
Mm-hmm.
So yeah, I wouldn't, I wouldn't dismiss that at all.
Mm-hmm. And the likelihood of them doing a laminectomy and me needing a fusion later on, you know,
Unrelated.
from unrelated. Okay.
Unrelated. If
Okay.
you have a fusion, it's incredibly likely that you're going to need another fusion later on. But if you have a laminectomy, that should not, in theory, it could make you more unstable, but instability is not your issue. So
Okay.
as a practical matter, unrelated.
Okay. 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 All right.